In our first story, Chief Executive of the University of Ghana Medical Center has revealed that 3 COVID-19 patients are in the ICU, with 8 others being taken through regular hospital management at the facility. Dr. Darius Osei tells journalists the facility has the capacity to manage patients, whilst health workers remain committed to helping combat the disease. Komla Adum joins us with more. Now, Komla, what more do we know about these 3 patients?
Well, Daniel, according to the CEO of the UGMC, these 3 people were part of the number that was brought here as people with the virus who needed medical attention. He mentioned earlier that when those who were on mandatory quarantine were tested and some tested positive for the virus, they were brought here. And they also included some of the other individuals that have been brought here and currently are in ICU. We do not know about whether they are male or female. We'll try and see if we'll get some access into the facility and then interact with some of these people. But he maintains that the 8 others who are not in critical condition are very stable. They are managed, they are in good condition, they are in high spirits, they are here, they are being taken through their paces, and the health workers are helping them through the stages of the recuperating process.
So the UGMC has 11 patients?
Yes, 11 patients in all so far.
And the 3 in critical condition were brought in when these 1,030 people went through mandatory quarantine?
According to what he mentioned, they were part of the pool of those who were tested after the mandatory quarantine period. We know that the country's borders were shut, and the president directed that those who came into the country must be put in mandatory quarantine, somewhere in hotels, somewhere in resorts, and they were tested. So out of that pool, those who tested positive, some of the numbers were brought here, and those are part of those who are being managed here at the moment.
Thank you very much, Komla Adum, for that. But in relation to this, tell us about the launch of CovidConnect. How will it help fight against COVID-19?
So that the COVID-19 in this era, all the talking points has to be about COVID and treatment available to patients. So at this particular launch, the University of Ghana Medical Center, in collaboration with Farm Access Foundation, launched this particular service. And the distinction is that it's not only an app, it is a service in totality, with the app inclusive. So what it does is that it helps the health officials here at the University of Ghana Medical Center monitor the health of patients. People who call in will have to give details of the symptoms that they are presenting with. If you have headache, for example, if you have runny nose, if you have sore throat, the app, which is the Lucy app, you can download on App Store or Play Store, will give you the options to input all those particulars, the symptoms that you are feeling at any given point. Then the medical expert will be able to pick these symptoms and then give information about how to get treatment, whether they are going to get you to the facility or whether you're going to undergo home management, etc. So this is almost like a remote healthcare delivery system. Right from the comfort of your home, you only have to use the app, send all the particulars, the details of symptoms you are feeling and all your health records. Then a team of medical experts that have been assembled here in a facility called the Coordination Center will be liaising with these individuals. They'll call them on a regular basis to ask how they are feeling and if there are any new symptoms since the last contact, etc. And then they carry out the process. And Daniel, you have to add that all this service will be at no cost. All you have to do is you have to be 18. You go to App Store or Play Store, download the Lucy app, LUSCII, and then you follow the prompt, and then you are good to go. Now, this particular service, at the moment, after this launch, is available to people who are in the Greater Accra region. In 10 days, we understand the service will be extended to other parts of the country.
Thank you very much, Komla, for bringing us those updates.